Welcome to our Catalytic conversation. Hi, I'm Andy Simon. I'm part of the Women's Business Collaborative, and we've been conducting Catalytic conversations in an expectation for an anticipation of our Catalyzing the Future, rethinking women's leadership in business. And afterwards, we've been using these to really hone in on areas of particular interest for our members, for the communities that we serve, for women in general. And today, I brought together two amazing women to talk about data. And I know that you're going to say data. And I said, well, data is the essential part of what Women's Business Collaborative is looking at to see whether or not the actions that we're taking and our partnerships and our members are actually moving the needle to help women become the best that they can be. Now, our job is to move further and faster together. But at the end of the day, we need some data and metrics to know where we are, where we're going, and how, in fact, we're getting there. So let me tell you about the two women who are going to chat with us today. Gina Papush is the Global Chief Data and Analytics Officer for Evernorth. Forgive me, Gina. Evernorth is a subsidiary of Cigna Corporation. What's important is she's responsible for driving data and analytic vision, strategic priorities, and objectives across the enterprise. She and her team leverage data and advanced analytics, enabling data-driven decision-making to deliver improved financial performance, operational and network efficiencies, and better overall healthcare quality outcomes, and greater stakeholder engagement and satisfaction. As she talks to us today, you're going to see why this data is so important for us to begin to make better decisions about women's access to care, what actually happens with it, and how we can make really, as she calls it, actionable information really work for us differently. Now, Connie Mcgee is our second speaker. She's an experienced healthcare executive with a diverse background in technology, business development strategies, consulting, healthcare industry leadership as well. With a consulting and sales strategy background, she leads a diverse team to enable care delivery models within the convergence of healthcare digital strategy. She was with Microsoft until recently, and she's a senior director in Nashville as part of the leadership team launching that healthcare vertical. I think you're going to find both of these women ready to share with you data. In anthropology, I'm an anthropologist, data do not exist. Out of context, we learned in Anthro 101 that there's no meaning. And so I think the most important thing as we were talking about this before our conversation was, what is the meaning of the data? How do we make sense out of it? How do we build stories that people can act on? And how do we build the right stories? We're going to start with Gina today. Gina, I hope I did justice to your resume. I apologize for my analytics mistake. Please share with the listeners, all about Gina and what you're doing and how the data matters so to you.
Thanks, Andy, and not the problem that data and analytics title is a bit of a mouthful, but thrilled to be here today. Thank you for the opportunity to share what we're doing at Evernorth and at Cigna Corporation. I have been very privileged to be part of Evernorth and Cigna for the past almost 3 years, working in the data and analytics space. My background is all in data and analytics. I worked across multiple industries, kind of got into healthcare later in my career, and it's an amazing industry that's incredibly data rich. And it's an industry that requires a lot of data and analytical thinking to solve some real problems, right? We're all recognizing while we have great healthcare capabilities in our country, we also have a lot of challenges, particularly with how expensive healthcare is, accessibility of healthcare, making sure that healthcare is equitable across all the different parts of the society. And, we certainly recognize, we're not perfect in this. These are difficult problems to solve. I am inspired every day by the opportunity to bring what we do into the solutions that we're working on, and how we make healthcare simpler, more accessible, more transparent, and more affordable through the use of data in actionable ways. You alluded to this earlier. We're very much focused not just on data for the sake of data itself, You know, you can probably spend an entire lifetime in any healthcare company trying to make the data better and never achieve 100% outcome there. But knowing that we can actually use the data to drive better decisions, to put the right information in the hands of our customers, in the hands of our employer clients who are actually sponsoring and funding benefit plans, in the hands of our government partners who are funding and sponsoring benefit plans, and making the healthcare navigation simpler, where someone gets to the right point with the right information at hand in a timely manner. That's where we're focused. Data in healthcare is very, very complex. Being data rich is sort of a blessing and a curse. A lot of our data comes in through a variety of channels that are very traditional. There is limited interoperability, unlike other industries that may have adopted and instituted data standards. In past years, we're just getting there. I think the pandemic has brought to life how important having the right information is. I mean, we really have all experienced this in this country, not having information about where the infections are rising, not having information about vaccination progress impacts our ability to combat COVID-19 and be proactive about it. We've gone a long way. I think there is much longer way to go. And many of these healthcare issues affect women and affect many minority groups. We have tremendous effort around this across Evernorth and across Cigna, because we believe we need to be solving these problems well beyond our walls. We're involved in many community efforts across multiple geographies. And specific to women's health, there are a number of areas where we're deploying data and analytics in new ways to actually help women who are working through some very challenging healthcare situations. One of my favorite examples, the work that our brilliant clinical analytics team is doing in oncology and specific to breast cancer, which is one of the prevailing cancers. And we know that combined cancer, diabetes, and heart disease are driving majority of healthcare challenges and costs across U.S. population. And in the breast cancer space, this is a devastating disease. It is curable, but it's very important that it's diagnosed earlier. There's been, a lot of great efforts towards that. On the health plan side, we often don't find out about the diagnosis after the fact, because a lot of the data that would actually give us that information is processed after the diagnosis has established and after someone started their treatment. Obviously, a woman dealing with this, has a lot on their mind, right? This is a very stressful time. We have all kinds of services, our care management programs that are designed to help someone who is getting through that. And we have case managers who can help them navigating the process, making sure, everything is covered appropriately, advising them what some of their options are, partnering with their doctors and their medical team. But when we don't know that they are actually dealing with a likely diagnosis, we're often after the fact. So we've done a lot of work building the data that actually tells us that there may be a likely situation where a diagnosis may be coming down, making sure we apply machine learning and other advanced analytics that can help us flag that kind of case and create an outreach. So we put the resources to work as early as possible, partnering with the provider and with the patient and helping these women make their choices in the most informed fashion and as early in the process as possible. We've been able to move a significant number of cases through this. We find that 60% more women actually engage with us when we do the outreach, find these services, very helpful. And, we are there and applying analytics to make it come together so we can enable, their treatment plan in the best way possible. And we take some of the burdens of having to deal with all of the care coordination and insurance paperwork to the extent that we can help with that as well. So it's just one example. There are many others, but it's a favorite one for me because it really tackles a women's health issue and it's real for many people.
What's so interesting listening to you, it's not a case study, but it is very much a case study about how the data can become very valuable to help an individual as well as a system really do better in their evaluation, diagnosis, care. It's not separate from, it's part of, which leads us to Connie, because I have a hunch you were using data and leveraging it in a related fashion, as if the two of you were bound together with different kinds of things going on in a different way. Share with us, how did you do this? How did you use the data? What role were you playing? I think it's very interesting.
Yeah, sure. Thank you, Andy. It's a pleasure to be here with you and also to be here with Gina, because if you think about, I've worked in healthcare now for over 20 years. So I've really seen this evolution of bringing the data forward and now how we're leveraging that data, as Gina was speaking about. And what I love is I sit across the table from people like Gina, okay? I lead sales teams, and I have for many years with Fortune 500 companies as KPMG, Intel, and also Microsoft. When we look at the data, I would say, you know, if I go back 10 years ago, I remember when, you know, as a member of HIMSS, we talked about big data. All you heard, big data, everything was about the big data, but everybody was really looking at it of what does it really mean? What are companies doing with big data? The next thing you know, it went to advanced analytics. And I worked with an advanced analytics company that was out of the Oak Ridge Labs up in East Tennessee. And it was interesting when we started working on that about the mid 2000, I would say 15 era, and then also with Intel. And it was really around advanced analytics. So big data kept evolving. But at the same time, when you look at a lot of our providers and our payers have been sitting on this data for over 50 years, not really knowing what are they going to do with it? How do they tap into it? How do they leverage it? Because, you know, a lot of that data is text, it's machine learning now, and they've been able to leverage that. But what do you do with it? How do you make it to where it's executable, as Gina had mentioned earlier? So now you go a few more years digital, and now all the transformation of digital and cloud, and everybody is looking at how do we empower our clinical community, our physicians, to be able to make well-informed decisions, earlier intervention in patient care.
Yes.
And with that, that's what they use, what Gina and her team are working on. And what they do is to get that data assimilated and out to all the data in the physician community to be able to leverage that. We've seen tremendous results, and as healthcare technology, working with a lot of the payers, providers, community, and life sciences, we really are looking at the struggles and the challenges they have of how they pull that data, how they are able to get that data out in the community in the hands of the physicians and clinicians. But at the same time, and I know Gina, you touched on it, when you think about oncology and the cancer patient and the journey that they go through, how do we make sure the patient journey is seamless? And could it be all in a day with all the data that we're using now, rather than the rigorous process in which so many cancer patients have to go through for so many weeks and the waiting? I mean, that is idea and nirvana. If we can have it all in a day for a cancer patient to go in and be able to walk out with a diagnosis and be able to have those treatments applicable to the type of cancer they have, and at the same time leveraging the genomics data that they have. So, you know, we've come full circle, and I think where we're going to be going now with digital, with 5G connectivity, being able to empower and get the data in the hands more quickly and expediently, I think that's going to be able to help us a lot. But Gina also mentioned something I want to touch on, and it is about, you know, when you think about women's health and how are we leveraging this, the health disparities is an initiative that I'm helping spearhead for WBC. And it's the health disparities around women, okay? Rural, urban communities, and that economy and the economics of scale. how the differences matter as to where we live, what we have access to, the type of health care. So we've got a few people that we're working on that right now, and we're going to be leveraging data and a lot of the statistics that we have access to currently to help women recognize whether they're at high risk for breast cancer, whether they're at high risk or they're a statistic for high blood pressure, heart disease, diabetes, obesity, you name it. That's the kind of thing that we've got to do a better job at, is leveraging where we've been, where we've come, and now where are we going to go and where are we going to take it. And I do think we've got to look at the consumer models. How are we going to empower not only the patients, but every consumer to be able to tap into their own data and their history and the genomic side and DNA. So that's what we do. Is right now we're helping a lot of different people, a lot of different companies and consulting. And I'm working with people like Gina, and we learn more and more every day because it continues to evolve. And the pace is so rapid and it's evolving daily that it's hard for everybody to keep up with all the changes that are coming at us. But it's an exciting place to be right now.
But you know, we're three women. And as I'm listening to us, I'm thinking about us as being that consumer. And where would a consumer begin? You know, and Gina, as you were talking, the last time we talked, you were very clear that this isn't about a consumer doing it on their own. And it's about this whole system being able to access the insights from the data to make wise decisions quickly. And to your point, Connie, I do think speed and ease is missing in action. And so you have, on the one hand, my ability to get into a portal, but do I really understand what that report says? Even my own medical records, when I look at that portal, man, I'm looking at it and then I'm going back to Google to figure out what is it telling me. And so we're hopeful. But the data, I always think about the data talking to me. Can I hear it? What is it saying? And as you're thinking, there's some key next steps that are really critical. What do you see as the most urgent and important ones that are coming? Because if we take them, maybe we can move the needle from hope to actual action. I'll start backwards. Connie, your thought.
Yeah, I think that we as a society right now have done a big injustice to the aging population.
Yes.
Because one, we've got so many, you know, when you think about the aging population, that is the greatest longevity economy, as I call it, that is, you know, going to be, you know, the boomers, everyone coming into the healthcare system. Yeah. But yet they did not grow up with technology. They did not grow up with this. So now we've got a huge gap between the millennial generations and the boomers of how do we educate and bridge that gap. They're looking at data. And some, you know, and I know I've got parents and I've got siblings. They really did not have access to technology. And some live in the rural areas and they don't even have Wi-Fi connectivity. So if we're going to help them, we've got to stand up the education process, but we've also got to make it easier to be able to access the technology, which I personally think, how do you get data into their hands if they don't have the Wi-Fi connectivity in those rural areas? And that's a big initiative for us in Tennessee right now out of Nashville and the governor. So we are working on that. But for me, that is the biggest dilemma and probably the biggest obstacle we have right now is bridging the gap from the millennials and then also the boomers. So.
Well, you know, I'll turn to Gina in a moment, but I was reading something yesterday that by 2030, a quarter of Americans, 75 million of them will be over 65.
Yes.
And that's global. It's not just here.
Yes.
That's a whole lot of people who, both men and women, but the women tend to live 10 years longer than the guys. So often it'll be a lot of women who in many cases have been insulated from access to technology, knowledge for, and trust of. I mean, there's a cultural phenomenon going. And then I have a client in Kentucky, and so rural is missing in action. There's no way to get anything that you would call new. So it becomes real interesting. Gina, your thoughts?
Well, I think it's sort of continuing where Connie is taking this. I think this is really segmented. Right? There is not one thing that you do across the board. I think it's very different for different subgroups. There is, you know, tremendous body of research that talks about aging, and what you just mentioned, the expected average lifespan for folks of our generations now, 100+ years, right? Yes. We're heading into a situation where 60 is not an age necessarily where you're towards the end of your life. You may be actually starting a whole new phase of your life, right? What we're also finding is access to care does vary, and the role of women in making healthcare decisions for their families is shifting. The research that we've seen from MIT suggests that women are exceedingly making healthcare decisions, not just for themselves, but for their families. So, in my mind, I think the greatest thing that we need to solve for is how we get them the right information that they can actually make good decisions with. How do we create what we describe augmented intelligence? And that augmented intelligence is delivered timely into the hands of the customer, so they can navigate their healthcare journey and make those healthcare decisions with the best information at their fingertips. How we get that augmented intelligence into the hands of their provider, right? We are not necessarily of a mindset that AI will be replacing doctors. We do not think that's a great idea. We are much more of a mindset that this is about the human being more enabled by the machine, and the intelligence that we can augment is going to help them make better decisions faster. But in the end of the day, nothing replaces the medical expertise that's required in every single case. So creating a way to put that into the hands of people who are actually driving this process or are affected by these decisions, that's a huge need in our mind. And it's also all about making it timely and making it easy and interoperable, right? And that it's a big challenge for our industry, and making sure we can share information seamlessly and make the information timely.
I'm curious, is there any benchmarking or standards that people could look at to see the progress being made in terms of access to care, access to wise solutions, anything that a person like myself could look at and say, wow, we're really making progress, stuff that you're familiar with? Either of you.
There are many metrics. I think the challenge is there are so many, right? And right, Connie? And you have a complex ecosystem, right? And you have there are lots of metrics that the CMS obviously puts out. That's probably the gold standard in many ways in terms of common metrics that are being used. There are quality of care metrics that are common across the industry, but it's probably not that easy to boil it down to a couple of simple numbers, and that's illustrative of the complexity of the task ahead.
Yep. Connie,
I don't know if you know of other sources I'm not thinking of.
No, I think you're spot on. I mean, it really is depending when you think about the benchmark, and a lot of it is, like you said, CMS has a lot of that data, but they have their own data and the metrics that they want to benchmark, the data sets. But then you also look at, you got a lot of people that are really looking and focusing on population health. Population health is one, social determinants of health. How do we improve healthier communities?
Yes.
So that metrics, I mean, that one is very interesting. So you got the health disparities, the population health, social determinants of health, and you could just keep going. And then, I think really what Gina is talking about is too, you've got the providers and the clinicians, and they have their own metrics. And at the same time, you have the oncologist, and you have them as well in cancer treatments, and they're using theirs. So, it's all over the board, but it is this entire ecosystem. And I think, to Gina's point, if we can ever arrive at interoperability,
yes,
we will solve a lot of problems. And I sit and go, I still don't understand how we've talked about interoperability for now, what, 20 plus years, and yet we are still sitting here and nobody wants to share data. Nobody wants to, and not nobody, but a lot of people just do not want to give up the data yet. And that is, you know, the entire ecosystem. It's not just one, but ideally we want to be able to give the patient the information they need. And it's their data. Everybody forgets this is their data that they should be able to have access to, regardless where they go for treatment or for a patient help and care. So
you're raising an important point, and we can probably wrap up in a moment, but I've been reading a great deal about who owns your data, who owns your DNA. You know, if you go to 23andMe and you've given them information,
yeah,
you still own it. If you're wearing wearables and stuff and it goes to places, my sleep bed will tell me in the morning how well I slept. And I'm wondering who else now knows how well I slept last night, and what my HRV was and my heart rate. And the question is a really ethical and moral one on one side, but it's the way our whole society is moving. And so going back to my initial point, the data by themselves do not exist. Out of context, they have no meaning. And as I look at my iPhone and tells me how well I slept last night, I'm saying, you want to talk to me about how my sleep was last night? You gave me a song to go to bed earlier, or with more deep sleep. This has been fun. Last thoughts as we wrap up our catalytic conversation. You can see why these are such fun, don't you?
They are fun.
No. Gina, how about yourself? Wrap it up with a last thought. I'll let Connie do the same, and then we'll say goodbye to everybody.
You touched on something that we really take very seriously, so I do want to wrap with the point of making, you know, the data serve a purpose and making it actionable and creating that actionable intelligence that can help drive better decisions, drive better health, drive better outcomes, help, you know, lower the cost of care. Those are top of mind. The ethical use of data is what you touched on, and the complex questions of data ownership. We like to think about this as who is a data custodian, who is supposed to be protecting, you know, the stakeholders and making sure that the data is used appropriately. That's top of mind, and it links right back into the health disparities and health equity topics, because making sure the data is used to do good is very important. So that would be maybe my parting thought on this conversation.
Yeah. And I'll turn to Connie in a second, but you're raising the moral and ethical questions of the very work you're doing, and it makes it even more important to do it well. It's exciting stuff. Connie, how about yourself?
Absolutely.
Yeah, no, I agree with everything Gina's saying. I love that we have access to data now, at least through our, our medical community. What I would also say, if I were speaking to other people, is there's still the human aspect of, you know, your body better than anyone. At the same time, the data is captured when you go to the hospital a lot of times, or during the proactive wellness visits. I am one all about being proactive about your health. And if we want to drive a lot of more of a healthier population, we've got to get people to take more ownership and accountability of their health, to be cognizant and educate themselves of what they're doing, making sure their healthy habits are out there. And then at the same time, when you're leveraging data with just human instinct, and like I said, understanding your body, knowing the warning signs, knowing whether you're living a healthy lifestyle or not, that's all very helpful. And that will help curtail a lot of the cost of healthcare as well. So
this has been an interesting period of time. I've heard of many pandemics within the pandemic that are related to unhealthy actions during a time of great serious crisis. It's been interesting. It's been wonderful. Connie Mcgee, thank you so much. Gina Papush as well. Thank you. Thank you for taking the time. I'm going to sign off, and thank you for coming to a Catalytic Conversation. Bye-bye now.